Welcome to the follow-up webinar, Motivational Interviewing, Building a Foundation for Effective Patient Engagement. My name is John, and I'll be your operator for today's call. At this time, all participants are in listen-only mode. Later, we will conduct a question-and-answer session. And now I'll turn the call over to Ashley Green.
Thanks, John, and good afternoon, everyone. This is Ashley in Madison, and I'll keep my announcements brief before I turn it over to Mia here. I just wanted to thank everyone for another fantastic workshop. It is your interest, your enthusiasm, your engagement that make these things so wonderful in terms of the learning that happens. So we were very happy to see you all in Marshfield. And I did want to let you know that if you enjoyed yourself, and I know that most of you did, because I just read most all of you did, because I just saw the interviews, please tell your colleagues at work about it. We do have another workshop coming up on April 20th in the Racine area. We're going to have a promotion going out about that pretty soon. I also wanted to let you know, because we're continuing to see interest in this, that Mia and I are talking about development of a community of practice across the state so you can continue to build and sustain your skills, as well as a couple of advanced workshops at some point, so be on the lookout for that. Today is a great opportunity for you to share some insights that you've gathered in the last couple of weeks since we were all together, and I know that Mia will encourage you to speak, and so I'd like to do that as well. The lines will be opened a couple of times for you, but if you prefer to use chat, you can certainly send questions to Mia that way as well, and I'll be sure to help her monitor that. So without further ado, Mia, I'll turn it over to you now.
Okay, great. Thanks, Ashley. And I just want to echo what Ashley said. It's, you guys really make the workshops fun and easy to do for me. I want to kind of apologize for your workshop. I know my voice wasn't at its strongest, so thank you all for just kind of bearing with me. And I wasn't thinking quickly on my feet as much as usual on that day, just because I had such a terrible cold. But we definitely made our way through it despite some technical hurdles and all that stuff. So I hope that it was an enjoyable and informative day for you. There's a few things that I want to cover on our call today, but really this call is designed to help us provide an opportunity for you guys to really think in a planful and strategic way about how you might want to carry some of the learning that happened in the workshop forward and continue to have it be present in your day-to-day work. So overall, the objectives for our entire series were to talk about the spirit of MI and hopefully give you guys a sense of what it is and a taste of what it feels like, to work with the skills of motivational interviewing, and we spent some time, more time on open questions and reflections than on affirmations and summaries, but we spent a little time on all of our ORs. And then also to talk about some specific MI strategies that you might use. And then, like I said, to think about a particular plan for you for your future development moving towards proficiency. And like Ashley said, keep your eyes open, because we've been talking about lots of good ideas and options for developing a little bit of a community of practice, because we've got you as well as some other cohorts around the state who've had this now really introductory basic level of MI training, and we've heard from quite a number of you that you'd like to kind of bump it up to the next level. So we're thinking about and brainstorming ways to do that. So for today on our call, we're going to talk a little bit about integration, how that's been going so far for you, what things you've tried out already, and how has it gone, and potentially what barriers you may have encountered as you've thought about or tried to put some of this into practice. And then we're going to spend a little time giving you guys an opportunity to think about and maybe give voice to a little bit of a plan for next steps for you. And we're going to talk about some resources that are available to you at this time and I'll go through and demonstrate a little bit of those resources for you. So I just want to remind you and sort of give you both permission to not be perfect at MI right now, and a little bit maybe of kick in the pants to keep you wanting to continue to keep this alive. We know that MI is not just one simple step or strategy or thing to do. It's a complex thing, and so learning it is a developmental process, and it requires a long-term investment of time and effort on your part if you really want to get to the point of proficiency, which is where we see the most sort of return on investment in terms of change in our interactions and change with our patient outcomes and our client outcomes. MI has been sort of likened to learning to play a musical instrument, right? You can get the basics down pretty quickly, but then if you really want to get to the point where you can just sit down with the instrument and easily play a fluid tune, it takes a lot of practice. We know from the research that people learn MI best when they have repeated chances to both practice those learned skills and get some feedback on how they're doing from someone with more experience or different, more learned perspective, and then to incorporate that feedback into what they're doing on a day-to-day basis. So I think we went through this a little bit. I may have mentioned this in our time together, but here are, for you, some potential signposts or ways that you can be things you can be paying attention to help you think about how your MI practice is doing, right? So the first one's pretty basic: listen more, talk less. That's not a very qualitative or a very quantitative assessment. It's not hard science. It's just, you want to be minimizing the amount of time that you're talking throughout your interaction and doing some work to try and amplify the amount of time that the other person is talking. Giving priority to the other person's perspective. And so thinking about, after a session, sometimes what I'll do, if I'm having a hard time sort of getting my finger on what to do next or where to go or why someone is stuck, I'll ask myself, what did I hear from this other person about why they particularly do or don't want to make this change? I'm thinking about how much priority did I put on hearing their perspective and making sure I fully understand that. Intentionally asking for the other person's own arguments for change, that's the change talk, and you have that whole sheet of particular strategies and phrases and questions you can pose that get directly at, or in a little less directive a way, get at that change talk from other people. Are you helping to identify successes and strengths? Are you helping the person have a greater appreciation for the strengths that they're bringing to the table? And are you identifying them and able to identify them when you think about that patient or client as well? Making sure that we're asking permission before giving advice or education. This one is just a slight restatement from the second bullet up above, but seeking first to understand. Before we jump in with our solution, before we try to do anything else, we want first to understand their perspective, the problem from their point of view, etc. And letting go of our need to fix it. Some of you noticed that strongly in yourself as we were doing some of the exercises, and just working on letting go of that urge to just jump right in with a quick solution. And we want to do more reflecting than asking, right? So remember our ratio of 2 reflections for every 1 question. Now that doesn't have to be, in that rigid of a way, like reflect, question, reflect. It can be, spread out. Sometimes you're going to have a whole string of questions. Sometimes you're going to have a whole string of reflections. But thinking about over the passage of your entire encounter with the person, we want to have about a 2-to-1 ratio on that. So some potential next steps, thinking about how you learn best, as well as, sort of what your time and resources allow you to do at this point. You could read. There are lots of books written about motivational interviewing. There's the general book, and then there are a lot of topic-specific books. You could view some more videos, and one of the handouts that you had in your packet that we gave you at the workshop lists a lot of online resources, and quite a number of those are video examples. So if watching those video examples in the workshop felt really useful to you, there's the links to those as well as other ones that are of high quality online. And then there's some other online learning platforms, and I'll go in a little more depth about a few of those in a minute. You can just experiment on your own. One of the things that anyone who's ever learned motivational interviewing can tell you is that your patient or your client can be your best teacher, especially if you're paying attention to the impact of the things you try and don't try. So if you reflect something, they're going to give you some feedback right in that moment about whether it was successful or not. And the general measure of success with a reflection is if the other person keeps talking. So noticing what happens when you try some of these strategies, when you try to put some of this into practice. There's the MI workbook that all of you have access to, and that has a lot of great different short readings paired with activities that you can do, either written or sort of some thought exercises that you can do. There are things you can do individually. There are things you could do with a group, which leads us to the next bullet on here, which is joining a learning community of peers. Many of you I know traveled to the workshop solo, but there were also some of you who came with a group of coworkers. So for those of you that came with a built-in group of coworkers, you already have a community of peers that you could enlist in your learning process and decide to do a little bit of an MI study group. Using the exercises from that workbook as a launching point. You could record yourself practicing MI and then listen back and do some appraisal or self-assessment of the skills that you show on that recording. You could attend an advanced training or engage a coach, and we've already talked about the potential for Metastar to be offering some of those options in the future. There are also other opportunities to attend further MI trainings. So when I mentioned, before I go in more depth with the resources, and we're going to in just a minute, I wanted to pause here and open it up because one of our goals on this call is to hear from you a little bit about either how it went. So if you've tried some of these things, have you maybe used the bubble worksheet or tried noticing your impulse to fix it? Maybe you've tried out some reflective listening, tried some of those change talk questions. It would be great if you could share with the group what you've tried and how you think it went, what you noticed when you gave it a go in the real world. So, operator, if we can instruct them on how to make a comment on the call, and then reminder that the chat box is also open at this time.
Thank you, and that's *1 if you do have a question or a comment. And I have no questions or comments on the audio side.
Okay, I know it's hard to be the first one to jump in on a call. You're all probably eating your lunches as well. So I wonder, let's just try the first half of this. If you've tried to put anything in practice, the bubble worksheets, reflective listening, open questions, etc., either type it in the chat box or *1 to unmute your line and share it verbally. Okay, so we've got one who just hasn't had a chance yet. I've tried this with pediatric patients. It works well to have them think of ways that they can increase physical activity. Yeah. So rather than you jumping in with all of your suggestions on ways they can do it, you've gotten them coming up with some of their own ideas of ways to increase the physical activity. That sounds great. I'm sure that, MI is really well suited for particularly that older pediatric population, sort of the tween and teen years, where some of the things that we really emphasize in MI, like supporting autonomy, really map nicely onto some of their developmental tasks. Because if you think about what that tween and teen population is really leaning toward, it's increased independence, autonomy, making their own decisions. They're working toward competency and mastery in areas of their life. And this really, maps right onto that, because you're working with them from a strength-based perspective, reinforcing their autonomy. So it's a nice fit for that age population. Who else has given something a try? I want to hear from a few more of you before we move on. Okay, really trying reflective listening. The chat box comments about that.
We did have a question online. Go ahead with your question. Your line is open.
Hello. Hi, my name is Sherry. And I'm just wondering, I actually used motivational interviewing with a diabetic patient. Unfortunately, he had a tendency to kind of get distracted and talk about other things. And I'm just wondering, during the process of motivational interviewing, how do you bring a patient back to the topic and kind of keep them, I don't want to say in line, but, engaged in what you need to be teaching that patient?
Sure. So how do we keep them focused and on topic, especially when they're showing us that they have a tendency to sort of wander into lots of other topics? So there's a couple different strategies, all with sort of varying levels of directiveness that you could use. One might be to, use the agenda bubbles, the bubble worksheet or the agenda mapping, and even increase the use of that visual tool by doing something like, having a little, I'm thinking like a colored piece of, paper cut out that's like a circle that would go around each one, so you could sort of highlight the bubble that you're focusing on right then and there. So sort of either covering up the other bubbles or, putting something that calls attention to that bubble, almost like a paper my kids are in elementary school and they come home with like these paper magnifying glasses that aren't really magnifying glasses. They're just cut out circles, but with a handle, but it helps them sort of focus on things. It's one of their reading tools. So something like that to sort of visually draw attention to the area of focus. And then asking them, when they wander off and they start talking, give me an example of something you would be trying to keep the focus on and something this person might be talking about instead. Do you have an example you can share?
Yes, I do. Can you still hear me?
Yes.
Oh, okay. I'm sorry. Well, for instance, when we were talking about his high A1C levels, he started talking about, his hobbies, building robots and so other things. So, I did try to kind of bring him back by, complimenting him, and saying, and doing some reflective listening by saying, I see that you have hobbies that you're interested in. And then just maybe, reinforcing the fact that he obviously had an interest in learning things, and reinforcing that it's important to stay healthy so he can continue to enjoy those hobbies.
Sure. Yeah, so that's a nice way to kind of try to connect it back using some reflective listening to sort of steer back in that direction. Another strategy might be to just ask him, I'm confused. I'm wondering if there's some connection between your hobbies and your A1C, that I'm just missing that connection here, because I thought we were talking about this, and I understand you're sharing some information about your hobbies.
Right.
And just putting that confusion, sharing that confusion and putting it back, as a shared problem between you and he, as opposed to holding it and having it be just your problem to manage. So that's another strategy, and it's a nice way that you could, sort of maybe combine using the bubble sheet with that strategy of sort of saying that. The other thing that I would wonder about is it sounds like when you have a mismatch like that, it feels almost as if he was trying to get you to see him as a full person. And
yes.
So I like what you did with that reflection. It sounds like you really like to learn things, and you have these hobbies, and these are all really important motivators for you to get your A1C down so you can continue to be healthy enough. And that's a really nice example of a way to use that reflection.
Right.
And show that you are listening to him.
Right.
Sometimes what I find is like when it feels like we're playing tug-of-war over the topic, to just let go of that control a little bit and just listen to him and show some good reflective listening, for a minute or two about
right.
his hobbies, and really let him feel understood in that aspect, and then
right.
ask him, would it be okay if we transition back to talking a little bit more? Thank you for sharing all of that. I feel like I know you as a person a lot better. Would it be okay with you now if we go back and talk a little more about your A1Cs?
Right, yeah. That sounds good. I'm going to continue to work with him. So I think that it will give me an opportunity to practice my motivational interviewing skills. But I wanted to get back and just ask you about the bubbles and using the different colors.
Okay.
So are you suggesting that you kind of share the bubble sheet with the patient?
Oh, absolutely. Usually when I use the bubble sheet in the beginning and we fill it out together, I will leave it sit on the table between us for the entire session.
Okay.
It's sort of like a map of where
Right.
we've been and where we're going and where we are now. So it's sort of like when I'm talking about, a magnifying glass or something, it's like a you are here arrow,
right.
on the map.
Oh, okay.
And so sort of visually calling their attention to it as well.
Mm-hmm.
It could be that some people just aren't used to having very focused conversations,
right.
Either culturally or for other reasons. Sometimes that just isn't the conversational style that people are used to. And so that's frustrating for us, right? Because we're ready to go and, down to business.
Right.
But
right.
they're feeling a need to, connect in a different way.
Good.
So.
Okay,
Yeah.
well, thank you very much.
You're welcome. Yeah, thanks for sharing that example. I imagine it was helpful for lots of other people to think about that challenge as well.
Right. Thank you.
So we've had some other additions in the chat box. We've heard some, let's see, Amy says she's used the open-ended questions, which have worked very well. Let's see, using the how do you question. Yeah. We've got some reflective listening being used at home, right? Especially in my discussions with my husband, reflective listening instead of interrupting him as I would have done in the past. I've used that as well. And I hear people saying using it with, Ashley, he's used it with his kids. Yep.
Works like a charm.
It it does. I like the tell me more about. Seems to work well with having discussions with patients in regards to their chronic conditions. Yeah, that's a really useful question. I ask it a lot. Let's see. The bubbles. Yep, and they get to enter their, sharing those bubbles on the agenda setting worksheet as a shared activity. Hearing that some people have put that into practice as well. Anyone else before we sort of move along? So for those of you who haven't had a chance to try anything out yet, if you can remember sitting in the workshop feeling like, yeah, this might be a good fit about a particular piece, I'm going to encourage you to try and give it a go sooner rather than later, because the further in time that we get out from the workshop, the harder it's going to be to put something like that in practice. And I know you all returned back to very busy days, and after having missed a day, I'm sure you had a mountain high to-do list to tackle. But if you can think about small ways to start incorporating pieces of this in, now it'll be easier not to lose those pieces moving forward. And thank you all for sharing the ways that you've put that into practice. That was great to hear, and I hope those of you that haven't heard something that sounded doable to you and maybe want to borrow from some of your peers some of the things they've put into place. So a couple resources that I just wanted to go over in a little more depth with you in regards to continuing to learn MI. The Motivational Interviewing Network of Trainers website has some good and reputable information, and it also has a link to a trainer listing and training listing. So if you're looking for more trainings, and this is an international organization, so there aren't a ton of them locally, but there are some. And then Guilford Press is the publisher that publishes this Applications of Motivational Interviewing series. And this is not all of them, but there are a few that I put up that seemed most relevant for those of you in the room. There's Motivational Interviewing in Nutrition and Fitness, Motivational Interviewing in Diabetes Care, Motivational Interviewing in Healthcare. There are also ones more specific to some behavioral health. So there's Motivational Interviewing in the treatment of anxiety, Motivational Interviewing in social work, Motivational Interviewing in the treatment of psychological problems. So there are quite a number of them, and they're not, that first one, the Motivational Interviewing, 3rd edition, is a hefty read. That's 400 and plus pages. But the other ones, the more applied ones, aren't super long, and they have a lot of good, detailed clinical vignettes, so you can read the conversation along with some annotation in the side to sort of explain what's happening. So for those of you, who do work in those areas, that might be something that is of interest to you. Again, not endorsing any one of these particular books, but just wanted to let you know sort of what's out there in the world. And then here are some free online resources that might be of interest to you. The British Medical Journal, that's BMJ, has an online learning module that is free. You have to register, but there's no cost for registering. It's geared toward providers, but it's not super provider specific. There's a little bit of it that's a little strange just because it's British and not American, but so, they say brief consultations, and that's basically to mean in a brief medical visit. And it takes about an hour. So this entire online course takes about an hour. What I like about it is that there are some short readings. There's some quiz and application questions to help you really think through the content that you've just read. And then there are some really nice demonstration videos done in there as well. This was put together by Stephen Rolnick, who's one of the original authors of the Motivational Interviewing book. One of the original architects for Motivational Interviewing. So the content is very sound as well. And what I didn't put the links because the links seem to always be changing, but what I did is at the top of the slide in black where it says BMG Learning Motivational Interviewing, that's a search term that you could enter into Google or any other search engine, and this would come up for you in your search. The next one that I want to go over with you is another free online resource, and this one is specifically geared toward pediatric or childhood obesity. But what I like about this one is it really helps with that sort of strategic thinking to think your way through an entire encounter or an entire conversation with someone. So the company that developed it is Cognito. That's the Kognito at the top of the page. And it was developed with funds from the American Academy of Pediatrics. So it's offered free of charge, and it is an application that you can download, either an online version that you can access from your desktop or computer, or you can download it, from the App Store or Google Play or Windows onto any tablet or device. The way this works is it's like a little video simulation. So it will there are a few lessons in there that you can either take or just skip through to the simulation part. And the simulation basically sort of presents you as a clinical visit where you're playing the role of the pediatrician, having a conversation with this child and his mother about weight management. And as you go through the simulation, it will pause. It'll play out like a little animated video for a minute, and then it'll pause, and it'll ask you as the clinician, what do you want to do next? And it'll give you a multiple choice menu. Maybe ask a question, provide some information, say this back to the person. So it gives you a few different choices, and depending on what you choose, then you can see the reactions from the child and the mother in the conversation. And so it helps you sort of walk your way through it. The other feature I like on here is you can sort of click. It shows a little meter to show the mom's motivation and the kid's motivation, whether you're increasing it or decreasing it with each choice you make. And you can also click, and little thought bubbles will come up so you can see like what the mom is thinking but not saying, what the kid might be thinking and not saying. So it's a little bit of a different, it's a fun little interactive tool that helps you think about, some of your strategies and choices that you might make in an encounter where you're trying to promote that. I found and I've heard from other people that I've shared it with, that it's useful even if you don't work with a pediatric population or don't work on, obesity behavior. It still helps you practice some of that logic and planning skills in MI. And then the third one is another free online course. This one's a little more dated than the other two, but it's done by the National Institute of Drug Abuse, NIDA, and they have an initiative that they call the Blending Initiative, where they're looking to blend promotion of health behaviors in with drug and alcohol treatment. So this is really looking at the health behaviors for heart health, cardiac health, so basically diet and exercise. And you can get CMEs if you go through them. You'll have to look at the details on the website to see if that applies for your profession. But basically there's a little course. It guides you through the skill development. They model it. And then there's also the patient simulation part. So you can do both or just one. And the simulation is very similar to the Cognito. The way it works, it's an interaction. You're face-to-face with this actor portraying a client, and he'll say some things, and then he'll ask you what you want to do or say. You choose, and then you'll see his reaction. He's a little less of a cooperative client, so if you want to give it a go with someone a little more difficult or challenging, this might be a simulation you want to do. You can do the simulation without taking the online course. You can just go directly to the simulation if you choose. So those are three free online resources. Like I said, you have those, and you also have some video resources and the book resources on the handout that you got. Should be the last page in your handout packet from the workshop. At this point, I'd like you each to think about, and I'm going to invite you all to write down, but you don't have to. Obviously, I have no way of controlling that. Write down one next step that you want to take moving forward from today to continue your learning or growth or development in motivational interviewing. So whether it's something, a skill or a strategy or something from the workshop that you want to put into practice that you haven't yet, or one of a workbook exercise, an online reading, one of these online courses, watch a video, one step that you're going to take to continue your MI journey. If you so choose to do that, you may say, hey, I'm done. Today's the last day I ever want to think about this MI stuff. And if that's the case, that's totally your right. But if it feels useful to you, I'm going to push you a little bit to try and move that into an action step of what's one thing you might do differently or new moving out of this call. And then I'm going to invite a few of you to share that so the operator can remind us of how to verbally share that, or if you want to type it into the chat box, that's fine as well.
Once again, that's star then 1 on your touch tone phone. I have nothing in queue at this time.
I'm going to trust that that's because you're all very furiously writing out your own copies of your plan, and when you're done writing them, you're going to either type something in chat or raise your hand to get it push star 1 to get into the queue and share it with the whole group. What one thing you're going to do moving forward from here is. All right. I'd like to check out one of the online courses just mentioned and be more aware when talking to clients to complete the MI steps. Okay, great. What else are people interested in trying to put in place? Giving that bubble sheet a try. Okay, let's get a couple more before we move on. Okay, interested in that community of peers. Yeah, so hopefully we'll get more information from what we're developing in terms of a community of practice here at Metastar. But in the meantime, you have a lot of peers around you that you can rope in to trying to keep this alive with you. What else, guys? There's something about making a public declaration of your intention that makes it that much more likely that you're going to follow through with it. Okay, looking for that MI and diabetes book. It's available through the publisher's website and also on Amazon. I think the prices are the same. So, and I believe, I could be wrong, but if you go to the publisher's website, they usually have a sample chapter available online that you can read and get a taste of the book before you purchase it. All right, last call for anyone who wants to participate. Okay, so at this point, that is the content that I had prepared for you guys today. Other than if anyone has any questions or comments that they want to share, it's *1 to raise your hand to get in the queue to speak it, or again, the chat box is always available. And either now or in the next minute or two, you should have the final evaluation available to you as well to complete. The final eval for this call. Anyone got any last questions or comments? You have on the screen my email, so if you have questions or comments or get stuck or want anything, you should have Ashley's email as well, and you can always reach out to someone at Metastar, and they'll get you to the right person. If you can't remember Ashley, just say it's the MI guy. Otherwise, you can reach out directly to me if you have questions or comments or things you're curious or interested in. And, a big thank you to Metastar for hosting this series. I think we've heard strongly from you guys that this is something that you find valuable and something that you would like us to continue to offer and to offer you some more advanced options. So we are working on that. And that's all I have for today. Ashley, do you have anything?
No, just thank you, Mia. We're just so happy to have you providing these workshops around the state. And I want to thank everybody again for attending the series and remind you that our next one is coming up on April 20th in Racine. And as Mia said, we're going to continue to move these around the state over the coming months here. So please talk this up to your colleagues. Don't hesitate to contact us if you have any questions or additional interest. We're always wanting to hear good feedback there. So with that, I'll just say thank you as well, Mia.
Yeah, I'm sure nobody's going to complain about getting a few minutes of their lunch time back.
Yeah.
So we'll go ahead and end it a few minutes early. Thank you, everybody.
Okay, thank you.
Thank you, ladies and gentlemen. That concludes today's call. Thank you for participating, and you may now disconnect.